to Canada and was a physician for the government of Saskatchewan for 13 years, after which she opened a private acupuncture and pain clinic in 1990. She's been the medical director at Gokavi Acupuncture and Pain Clinic for the last 34 years. She has held executive positions with the Acupuncture Foundation of Canada as president, past president, board of directors, and education liaison, as well as an AFCI mentoring program coordinator. Dr. Gokavi has also been examiner, lecturer, and instructor for the teaching faculty of Acupuncture Canada. As part of her 40 years of practicing acupuncture, she has been a faculty member of the AAMA. She also pioneered and authored the Gokavi Transverse Technique, or GTT, the treatment and management of chronic myofascial pain release, and has lectured and taught seminars on GTT across Canada, USA, Puerto Rico, Australia, New Zealand, and India. She's been a guest speaker and on an expert panel for pain at various conferences internationally across Canada, USA, Australia, New Zealand, Puerto Rico, and India. Welcome, Dr. Gokavi.
Excellent. Thank you so much for inviting me. It is a real pleasure to be here today. I think it is a great idea that you are hosting and organizing these webinars so that you get the expertise of various practitioners in treating and sharing their knowledge and experience in using various modalities and treatments on the clients. Before I do my presentation, I will kind of tell you my health journey of how I got into acupuncture and dry needling. As you know, I came into Canada. I finished medical school in 1971 and came soon after to Canada. And when I was 22, and then I had to requalify and do my rotating internship. And it was while I was doing my internship that I had a fall and I tore my meniscus. I was working in orthopedics at that time, and my boss said I should have surgery because my knee was locking quite often and it was painful. So I proceeded to have the surgery. Unfortunately, about 12 hours later, I was having excruciating pain. I was in a full-length cast because I had an open meniscectomy. I couldn't put my leg down. My husband actually had to hold my leg because it was so excruciatingly painful. I went and saw my surgeon a couple of days later, and he cut a window in the cast, didn't check my dressing, and I was back to work in a week, limping and lugging this heavy cast. And when they cut my cast and took it out, I was oozing pus from my incisions for months, and it was totally infected, and I had a septic arthritis. As a result of this, I was unable to go into a specialty of my choice. I thought I'd be an obstetrician, but I was told I could do maybe radiology or psychiatry. I did 2 years of my residency then. I hated it and went into family medicine. In 1980, I was in a car accident, and I ended up with the thoracic outlet syndrome. And again, they said I needed surgery, and I was so paranoid about the surgery because it messed up my knee, and I wasn't prepared to get anyone touch me with a knife. But then at that time, there was a big article in the New England Journal of Medicine that said that acupuncture is one of the best modalities in the treatment of pain. Now, I didn't know anything about acupuncture except that it was an ancient art of healing. So, and Acupuncture Canada was sending out brochures every month to physicians trained in acupuncture in Toronto. So I decided I'm going to try this and see what this was all about, how it worked, etc. I went to Toronto, and Joe treated me, and Joe Wong is amazing. He's been my mentor to do all my courses, earlier courses. And I felt so much better. And so I proceeded to take the rest of the courses, got my certification, got my exam. But then what happened? My knee started to get progressively worse. And couldn't put needles in my knee because of my history of infection. And so I ended up having to undergo a high tibial osteotomy. Again, I was in a cast for 9 months, lots of complications with infection, septicemia, etc. Over those periods when I started my, I ended up having to take numerous courses once I started my practice in acupuncture so that I could just work a couple of hours a few days a week, because I was saying after all this studying, I didn't want to be sitting around. So anyway, when I took all these numerous courses, I took scalp acupuncture, ear acupuncture, hand acupuncture, TCM, all the TCM courses. I did facial acupuncture, facial rejuvenation, Korean Japanese acupuncture but the one that impacted me most was the IMS. Uh, as you know, in those days, acupuncture was still not mainstream medicine, so people would come only when they had no other options or with chronic conditions. And I was helping them with pain, but I found when I stopped doing acupuncture, they would come back with the same problem. So when Dr. Gunn was teaching us the IMS, he he what he said made so much sense, because he was getting rid of the cause of pain with all the myofascial tightness and trigger points. And he then treated a lady on the podium, and she screamed and cried. And I was thinking, how does one treat a patient who comes to you with pain and give them more pain? And then at the break, I went and saw talked to this lady, and she said the treatment was very painful. But after that, she said her neck and shoulder felt so much better. The pain was down. She had more range. So I was very impressed by this, and I was so excited to come to my clinic on Monday to try this technique. The first patient I had was a patient with Achilles tendonitis, and she was doing well with my treatment, but she still walked like a penguin. Her calf was really very tight, and the calf is one of the worst muscles to needle. Anyway, I tried telling her, I've learned this new technique. How about letting me try it? Unfortunately, it does cause bruising and it's very painful. And she said, thanks, but no thanks. I've got enough pain. And so she wouldn't let me do anything. So I treated her with the acupuncture, and I always give relaxation points when I do acupuncture. And so then I approached her again. I said, are you sure you won't let me do this? She said, okay. I proceeded to treat her, but in a few minutes, she started screaming, and I stopped because I didn't know what my other patients were thinking in the waiting room. But 2 days later, my secretary got this excited phone call saying that was the best treatment she had from this lady. And she said, forget about the acupuncture. This is what I want. So that's how I started doing a lot of IMS also. However, I found that the patient compliance was becoming an issue, and patients were getting needle phobic. You couldn't go deep into the neck, into the shoulder, the upper back and lower back and the chest. And so I was kind of wondering how we can go about this. And one day I had a patient that came to my clinic, and she had fallen on ice and had fractured her elbow and her wrist, and she was getting therapy. This happened 2 years before that, and she was a very gifted pianist, and she couldn't play the piano, and her span of hand, she couldn't play the octaves on the piano. So somebody in her church told her about me, so she came to see me, and in one treatment, I was able to loosen up everything, and she couldn't believe that she was going for therapy for so long, and in one treatment, I had fixed it. A couple of months later, she approached me and wanted me to speak at the National Convention for the Registered Music Teachers, yeah, Conservative Music, and it was in Saskatoon. And I told her, listen, this is all medical. Can't speak to lay people about it. But she said there were so many gifted musicians who do not know about this technique and have to quit. So I finally conceded and spoke at this convention, and I treated a lot of people on the podium like I usually do, necks, shoulders, etc. And one of the people who was at the convention was a lady from Toronto, and she came and booked herself up to get a treatment from me right after. And she had fibromyalgia, and she had been in a 13th hour accidents, a lot of issues. And she did so well with the treatment. After she came to see me, she used to come and see me quite regularly every few months. And one day when I was treating her, she said, you're doing something very different. I don't feel the needling. Everything feels really numb. And then I looked at my machine and I found that I had used a higher frequency. So then I started to experiment with the various frequencies, and I found that 200 hertz, I could relax the muscle. And then at 500 hertz, I could numb the whole area. But at 1000, it was horrible. So I was able to reproduce this on all my patients. And so people started, and I was getting really amazing results. I could go in deeper. Patients were not needle phobic, and they were able to tolerate the needling very, very well with the current. And so people started asking me to teach this technique. And so that's how GTT was evolved. And I found that I could get deeper, get longer lasting effect. And so when I started to teach it and wrote the book on it, and I taught it across Canada and then USA and then Puerto Rico and all the other places. So as you can see, I've been doing acupuncture for over 43 years. I've been doing dry needling with GTT for over 25 years, and I've been teaching acupuncture for over 35 years now. So I've been doing it a long time. And my patients were my best teachers, and I've helped more people with what I've done after starting the dry needling and acupuncture than I did with all the years of family medicine. So that's my journey about how I got into acupuncture and dry needling. Now, my case presentation, when Celine asked me to do the talk at the webinar, I was debating on what kind of a case to present. And then she said, pick a challenging case. So I was going through all my files and trying to figure out what case to do when I saw this gentleman about in November, and he was a very interesting and a very challenging case, and I thought I'd present it this webinar. Sorry, I'm trying to get the PowerPoint. Yes. Sorry, just trying to get this going. So this case, this is a gentleman who never had acupuncture or dry needling before, but has tried every other therapy over the years with very temporary relief. So sorry, just trying to get this PowerPoint slide going. He's a 79-year-old man who came to me with numerous problems. Sorry, this PowerPoint is not coming on. Just a second. Okay. This and that. Sorry, so this 79-year-old gentleman came to see me because he tried everything else and nothing else worked. So he came in, he's a retired school teacher, he married twice, no children. His hobbies were woodworking and wine making. His main complaints were he had pain in the right thigh for over 2 years, pain in the right shoulder for 3-4 months after his dog knocked him over. He had pain in the lower back on and off for 16 years, pain in his feet with numbness in his legs for over 10 years. And he found that wearing shoes, where in the last few months he just could not wear shoes, and in Saskatchewan you cannot get around without shoes because it's so cold here for 5-6 months of the year. He had great difficulty walking and had very poor balance and posture balance for the last 3 years. Now his past history is really horrendous. You can see he was, as a young teenager, he was in a car accident, and he had they actually thought he was dead, and then he had head injuries, he had brain damage, he had fractured both femurs, he had skull injuries, he fractured his jaw, he's fractured his ribs, and he was in a coma for over 3 weeks. For the next few years of his life, all he saw was he was in the hospital and getting construction of his jaw and seeing orthopedic surgeons, neurosurgeons, psychiatrists, psychologists, physiotherapists, chiros, and massage therapists. And in 2000, over all these years in between, he was living with a lot of chronic pain. However, he managed to get 2 degrees, became a teacher, and was able to teach, dealing with all these issues. Unfortunately, in 2008, he fell off the second floor of a log cabin which he was building, and he shattered his right femur, and he was flown to the hospital and had to have surgically repaired with a long metal rod. He had also fractured his spine, and so he has lived with chronic pain since his MBA, as complicated after this fall. He was in a brace for 6 weeks for his back. 2016, he continued to have chronic pain with difficulty walking. He had a total knee replacement on his right side. And then in 2018, because of continued pain and difficulty getting around, he had his left knee done. But in 2020, when he moved to Saskatchewan, he was in a lot of pain. He couldn't walk without assistance. His pain was getting uncontrollable. Trying to get a doctor was very difficult due to COVID. And all they did was phone consults and prescribing more and more painkillers. He described himself as being immobile drug zombie. Finally, in 2022, he was able to see an orthopedic surgeon, and he decided he needed to get his right hip replaced. However, the waiting period was for over a year, and he was increasing his pain meds, and then it got so bad he was, as I said, unable to walk unless he had 2 canes and with assistance. Finally, in 2023 April, he was called to the hospital, and he had his hip replaced, which dropped his pain considerably. However, after 2 months, his pain started to return, and especially in his right thigh. And again, he also had another fall when he hurt his right shoulder when his dog knocked him over. His other problems were hypertension for 5 years under control with meds, and he was taking amlodipine, Tylenol, and Advil. He stopped taking a lot of the pain meds after the hip replacement, but the pain was coming back, and he was taking vitamin D3, K2, multivitamins, and omega-3. On examination, he had decreased range of movements in all directions, especially extension and lateral rotation to the left and some neck flexion. He complained of his neck being very stiff. He had weakness in the 4th and 5th fingers of his right hand and his right shoulders. He had restriction with abduction, internal and external rotation, and he had rounded shoulders, poor posture, and his right shoulder was elevated more than the left. On palpation, he had numerous trigger points in the pectoralis muscles, subscap, traps, latissimus dorsi, trapezius, supraspinatus, infraspinatus, and tenderness over his cervical spinal nerve points C3, 4, and 5. His deep tendon reflexes, myotome, termitums were normal in the upper extremity. The examination of the thigh, he had right hip range of motion was slightly decreased in all directions, particularly in adduction. On palpation, he had numerous tender trigger points in his adductor magnus, his quads, hamstrings, and some wasting in his vastus medialis bilaterally. He had trigger points in his rectus abdominis, his psoas, and his hip was hiked up, anterior rotated, and leg discrepancy was present with the left hip higher than the right, with the trigger points in the QL and his glute med piriformis with the straight leg raising. Quadratus lumbar was really tight with trigger points, and he had a mild lumbar scoliosis. Now, his legs and feet, he had clawing of his toes with a pescavus deformity with high arches in his feet. He had decreased sensation. He couldn't feel any of the needles of pin and needle below both knees. The plantar flexors were both down. The knee and ankle reflexes were either weak or absent. And the range of movement of his ankles was mildly weak in dorsiflexion and plantar flexion. He was unable to lift his left leg at all while standing. His balance was really very poor, and he had a very abnormal gait, and when he came in, he was using a cane. And the patient has had numerous x-rays of his back and his hip. He had ultrasound, bone density over the years. Again, it showed degenerative changes of the spine and the lift and his left hip. Again, mild lumbar scoliosis and spinal stenosis with compression fractures of L1 and L2 vertebrae. The right hip and both knees show the joint to be intact after the replacement. So the orthopedic surgeon and neurologist said they couldn't do anything, just take more pills. EMG of his legs done, and actually just recently, it was in February, was showed that confirmed that he had neuropathy. Now, the first treatment, when somebody comes with those kind of symptoms, and there are multiple symptoms, as you see, he's a 79-year-old older gentleman, so acupuncture people don't respond as well as a younger patient. He had numerous surgeries, and he had the meridians are cut, the scar tissue to deal with, and he had total knee, total hip, total both knees done. And he also had a lot of injuries. So when there's that much of scar tissue, so I was wondering, I was limited in what I could do with a patient like this. And so I always tell them when they come with problems from top to toe that I have a magic wand, and and I tell them, where would you like me to start treating, and the order frequency of their body where they'd like me to start working on. So he told me to treat his whole right side. I told him, depending on how he tolerates the needling, we'll see how he goes. So the first treatment was November 15th. And the treatment the next year, the first thing I did was vital alignment, which is a Dr. Stephen Young technique where there's a blockage of chi. So you do these points. He had a head injury. So I did GV20, GV24.5, GV14, and GV4. Within a minute, he said his neck range increased, also his strength increased, and his shoulder felt much better, and so did his back, but there was no change in his leg or thigh or his legs. And then I had to balance his autonomic nervous system, because this was a man who was dealing fight and flight for years. So to calm the autonomic nervous system, instead of giving the sympathetic and parasympathetic points, I use Shinman and sympathetic in the right ear. Then I usually give relaxation points, but with GV 24.5, he seemed fairly calm. He was tolerating the needles well. So I didn't bother with giving him any more relaxation points, because the patients are really anxious. I can give acupuncture points enough if there's equivalent to giving 5 milligrams of Valium IV push. But he did well with GV 24.5. So I proceeded then to do the energy points, because this man is running on empty. He's been dealing with chronic pain for so long. I needed to boost his endorphin levels up. So I gave Moxa with CV8 and stomach 36 bilaterally. I had to restrict how many needles I could use, because I had a lot more needling to get done. I then added gallbladder, as when you're dealing with the musculoskeletal system, the spleen is the meridian for treating muscle issues. And because this was a chronic muscle issue, I gave spleen 9. And because he had chronic tendon muscular problems, the point for chronic muscle tendon issues is gallbladder 34. It's also the influential point for muscles and tendons. And then for bony issues, chronic bony issues, normally I would have used kidney 10, but I couldn't because he had a prosthesis. And so I had gave him kidney 3 instead. And because he had problems from top to toe, I also decided that there was no point. I better use the extraordinary meridians, which covers the whole body. So I gave UB62, SI3, gallbladder 41, and triple energizer 5. And then in the neck, I was able to release all the trigger points with the dry needling of the pec, subcap, lats, the triceps, supraspinatus, infraspinatus, levator scap, and did periosteal pecking on the cervical spinal nerve points of C4, C4 and 5. And also I did triple energizer 14 and LI15, loosening up all the area around in the deltoid. Now after treatment, and then when I went to the back and the thigh, I bled bladder 67 with a lancet and got out about 4 or 5 drops of blood, and that relaxed the whole bladder meridian and his hamstrings. And then I did the GTT dry needling of the adductor magnus, which was filled with, there was numerous trigger points. I was bending numerous needles, and because it was so tight. And then I went to the quads, the rectus abdominis, the psoas, and then the QL and piriformis and glute med. I loosened up the SI joint and did the facet joints or the Huata Jaji points in the lumbar spine, and finished with the suction motion cups. Treatment of the leg and foot was a different story, because his leg was so numb, and his right leg, he said, was like just felt like clay, and he couldn't feel any of the needles. And so which was a good thing, because the calf is the worst muscle to do the dry needling. I released the trigger points with the myofascial tightness in the soleus, gastrocnemius, the peroneal muscles, tibialis anterior, and the interossei of the foot. And when I finished the treatment with the suction cups, as I was needling his leg, he started to feel all the needles, and he said I'd woken up his leg, and it felt at least 75% of the numbness had gone. The immediate results are the first treatment. He had no pain in his right shoulder and neck with the full range of motion, was able to lie on his right shoulder without pain. His pain in the back was good. He was able to turn in bed with no discomfort, which he couldn't do before. He had no pain in his right thigh, just superficial soreness from the needling. And then he had marked improvement in the numbness of his right leg and foot. And he said, except for the big toe, which was still numb, he said it was 75% better. His balance standing on the right leg improved, but he still needed a lot more work. So because his gait and his balance with the left leg was really poor. The second treatment, I saw him a month later, and on December 13, and he came in without a cane. He was able to wear his shoes with less discomfort. He continued to have no pain in his shoulder and was able to do all his woodworking. He was able to stand longer because his back was feeling much better, and he was able to sleep better. He didn't have to take as many medications for pain. And but the thing, and he said this leg, the left leg was really bad, and he wanted me to treat his left leg this treatment. But he was very happy with the marked improvement of the first treatment, especially it lasted for the whole month till where I'd left it. So I repeated the vital alignment, governing vessel 24.5 and GV14. I did the energy points with Moxa, CV4, CV6, CV8, stomach 36, but I added spleen 4 and P6 with the extraordinary meridians to get the internal branch going into the spine. Then I added governing vessel, gallbladder 34, liver 3, spleen 9, spleen 6, and kidney 3, and the Bafang points with each stem bilaterally for 15 minutes. I did the GTT circuit of the lower back and the left hip to get his balance better. And then I released all the trigger points with dry needling of the adductor magnus again on the left leg, quads, hamstrings, TFL, QL, glute max, medius, and piriformis, and finished with the SI joint and water GRG points of the facet points. I loosened up the left leg, again, the soleus gastrocnemius, and finished the treatment with the suction cup. The patient bent numerous needles during the myofascial release of all the muscles, but he was able to tolerate the needle well with the GTT circuit. He was able to lift his leg, which he could not do prior to treatment. He had almost like a foot drop. Then his balance improved, but still needed some work. But the numbness persisted in his foot and improved very minimally in the leg. So I asked the patient that he needs to see a neurologist and get some nerve conduction studies done, because I didn't know whether the peroneal nerve was cut or whether it was from the spinal fractures that he had or the spinal stenosis. And I saw him 2 months later. He had seen the neurologist, had an EMG, and was given a diagnosis of peripheral neuropathy of unknown etiology. And the patient wanted me to continue to treat his left leg. So this is treatment 3. I again proceeded to do the vital alignment and scalp acupuncture, but this time I did scalp acupuncture using the motor sensory lines for the lower limb bilaterally and added the foot motor sensory line. And I did strong stimulation for 45 minutes. Then I added master tongues, peripheral neuropathy points with each stem on the left leg, the Bafang points on the left foot, and gave him energy points. Again, conception vessel 4, 6, 8, stomach 36, and did spleen 4 and P6, the extraordinary meridian. And then added gallbladder 34, spleen 9, spleen 6, liver 3, kidney 3, UB62, SI3 with each stem. Then I did the GTT with the dry needling of all the leg muscles below the knee. Prior to this treatment, this patient was unable to feel any of the needles being put into his leg and foot. But once I did the scalp acupuncture and was able to feel the GTT dry needling, he could feel it being done, he could feel the needles, and then he stated that I'd woken up his legs, which were asleep, and felt like lay for a long time. When he stood up, he was able to feel the floor under his feet and under his sole, which he hadn't done for a long time. I advised him that I would continue treating him until he plateaus, and he stated that he had tried pretty well everything in the past, and he was so happy that he was continuing to improve with each treatment that I'd given him. So the clinical outcome, despite the complicated history and the chronic problems involving the numerous injuries and surgeries Using acupuncture, particularly GPP dry needling, which treats the cause of chronic myofascial pain, I was able to make a significant improvement with each treatment, despite the fact it was an older patient with chronic problems, numerous injuries, multiple surgeries, and having to deal with scar tissue, and also having prosthesis in 3 joints, big joints. I wasn't able to go into any of those areas. Now, the clinical hypothesis, the differences in the approach of treatment of acute versus chronic. If a patient comes with acute pain, it's a different story. You do the vital alignment, you do the tendinomuscular meridian, and as I said, for acute injuries, you do spleen 8, for acute bone injury, kidney 5, acute tendon ligament injury, you do liver 6. Give them treatment if they're in a lot of pain, GB26, liver 3, or LI4, and then you do minimal dry needling and finish with suction cups. I was teaching in Edmonton, and I'd gone to visit a friend of mine, and I was having tea with her when her husband called and said he was in a car accident, had totaled his car, and he was in emergency, getting to check out if he had broken anything. When he came to the house, he was in a lot of pain. He was as stiff as a board, and he had a really bad whiplash injury. And it happened that my husband called at that time and said, "What, you haven't fixed him with your needles?" And I said, "Well, I deal with needles, and they didn't want to impose on me because I was visiting. But I had my briefcase with all my supplies, so I said I'd be happy to treat him." And all I did was the TMM and vital alignment of TMM, loosened up his pecs, which the airbag had blown up, and his chest was really sore. Treated his trapezius and his neck, and finished with the suction cups. And the next day he called me and said it was like as though nothing had happened. So treating an acute condition is very different as compared to a chronic condition, like the patient that I just presented. So doing the vital alignment is important to correct the blockage of chi. And then you have to balance the autonomic nervous system. Now you can use the sympathetic parasympathetic switches, but if there are a lot of problems, just doing the Shenmen sympathetic and the dominant ear works. Then balancing the yin and yang is by using spleen 21. Then harmonizing the upper and lower quadrant, you do the put governing vessel 20. You can do meridian balancing, which also corrects everything. Every time you get the body into balance, you get better results. But for chronic muscle injuries, again, as I said, I use spleen 9 for chronic bone injury, kidney 10, and chronic ligament tendon injuries, you use gallbladder 34. The relaxation points you always give so that you get better endorphin release. These patients are dealing with a lot of chronic pain, and so you need to boost the endorphin levels so that you have something to work with. Energy points with Moxa, again, is so important. As you know, using governing vessel 44 is your point for congenital energy governing, and conception vessel 4 is for transportation between acquired and congenital energy, and conception vessel 6 is your point for acquired energy, and conception vessel 17 is for the influential point for energy. So when you use these, you get a big boost of endorphin levels. Now you have something to work with, and this prepares the condition for doing the dry needling of the base of the foundation. Now, I had a patient that I was teaching in Winnipeg, and they brought me a case. He was an amputee. He had been in a farm accident. He was about 50 years old, and he had fallen on his shoulder, and couldn't use his right shoulder. So he had come because he was getting the physiotherapy, but shoulders can be so dicey to treat. So I was able to loosen up his shoulder and get his full range back. However, I asked him if he would like me to treat his phantom pain because he's had it for 21 years, and he said nothing had worked. I did the scalp acupuncture on him, and believe it or not, in 15 minutes, I was able to get rid of the pain. So using your microsystems of acupuncture is very powerful to be used, especially in neurological conditions. So chronic pain, and now with the dry needling component, once the acupuncture part is done, which has set the foundational basis to be able to do the dry needling. Now, the GTT is an advanced dry needling technique used in high-frequency electrical stimulation in the treatment of chronic, especially chronic myofascial pain and dysfunction. This GTT circuit bypasses the endorphin cycle and stimulates the production of serotonin and noradrenaline. The high-frequency electrical stimulation relaxes the muscle and can also numb the area, allowing larger areas of the body and deeper areas to be needled. This corrects the muscle imbalance by treating the antagonist and agonist muscles, reducing the pain, improving mobility, and establishing normal function. And what it is doing is getting rid of the cause of pain. And that's why the results can be so dramatic when you do this. The muscles are also always treated in a specific order because one relaxes the other. The GTT dry needling, the needle is not only diagnostic but therapeutic. And I had a case that came to see me. She was a nurse and she was diagnosed with fibromyalgia, she said, and she had all the symptoms of all the tender points and chronic fatigue. But when I started to needle her, the needle slipped in very easily. There was no myofascial tightening or the gritty feeling that you get when you're doing muscles that are really tight. So I examined her further and went into her history further. And I said, I think she may have some kind of autoimmune lupus or MS or something. And sure enough, she was diagnosed with MS. So the needle is not only diagnostic and therapeutic when you do dry needling. Now, GTT addresses the referred pain patterns of all the muscles, and often the site of pain is not the cause of pain. And it is very important to know this because your patients are giving all the history, they're telling you everything, and just because you're not getting the results you want, it's either your diagnosis is wrong or your points or area are wrong. And so I had a case that I was teaching in Vancouver, and I was doing an advanced level acupuncture course with one of my colleagues, and they brought in this patient who was in a car accident 3 weeks prior, and she had severe pain at 9 out of 10, and she had hit the knee on the dash of the car with the accident. And my colleague had done the points for the knee, for the acupuncture heading and all the knee points, but it didn't seem to make much difference. However, when I was looking at her knee and went to examine it, she had a beautiful vastus medialis and the quads. That's one of the first muscles that wastes when you have a knee problem. And I know all about it, having undergone 39 surgeries on my knee. So I ran my finger up the thigh and I found a huge trigger. I took a needle and released the big trigger, and this lady just jumped out of the bed and said, I don't know what you've done, but you've got rid of my pain. So you get very dramatic and immediate results to the GTT dry needling. The most dramatic case I had when I was teaching at a WCB facility doing an advanced level dry needling course in Edmonton. And they always wait for me to come there to do, because they get me all the difficult cases at the WCB facility. They brought this gentleman who had fallen off a crane from 115 feet, and he had fractured his spine, he had fractured his pelvis, he fractured his femurs, and he was getting physiotherapy out at the WCB facility for 5 days a week. And I saw him after 2 years after this accident. Or no, he came in a wheelchair, and all they were trying to get him to do is to hold on to pulleys and hoist himself up to stand up. So I did my usual vital alignment, gave him some energy point, and proceeded to do the GTT dry needling all on his back, his pelvis, his hips, his thighs. And then I got him to stand up, and I said, can you stand up and walk? And he got up with no problems. Then he walked across the room, and then he climbed up even a flight of stairs. And it was the most amazing results that we've seen. And both the patient and all the students and I were so amazed and happy with the results that I got, that the patients have proved me wrong so often. So now I always tell them, we'll try one treatment. If I can make the difference, then we'll continue. Now, the other thing is when you're dealing, some of the cases you don't, with dry needling, don't get the same kind of results as like a patient. There's bony and mechanical issues like spinal stenosis. I had this patient with rheumatoid arthritis. He was 75 years old. He had rheumatoid arthritis for about 45 years. His hands were so totally crippled. He came to me to get his knees treated, and I was treating his knees, and he said, can you do something with my hands? He was a retired farmer, and he wanted to be able to hold a fishing rod. I said, we'll give it a shot. And I loosened up all his, I gave him the acupuncture and then the Baxi points. And then I loosened up all his introits, his forearm and his arm. And after a couple of treatments, he was able to hold a fishing rod, and he was so thrilled and happy and couldn't thank me enough, even though he had all the deformity with this in his hands. The other conditions that you may not get the same results with is when there's scar tissue. I had a patient that came in after having surgery on his mandible. He was a young dad with two little kids, and he had to go to Edmonton to get. He had ended up having cancer of the mandible, and he had radiation and chemotherapy, 35 rounds of radiation, and his skin was like leather. And he came to see me after. He said he had a clean bill from the oncologist that is cancer free, and I tried to needle this. I couldn't get the needle, and he was so overly sensitive. So I told him to come back again. I treated his neck, which improved, but however, the face, he couldn't open his mouth. He used to drink through a small straw, and all he could take was a little bit of liquid at a time. I told him to come back after a couple of weeks, and I did use the GTP circuit on his face, and I was able to loosen up his jaw enough after a few treatments. And all he was hoping he'd be able to have a tomato and cucumber sandwich, which he was able to do. I opened it enough. I even had to go into early and loosen up steroids and everything, but I was able to achieve it despite all the scar tissue. So till you try, you never know what the results you're going to get. So again, also when you do cases, there's so many patients who get desperate and they end up with surgery, and often sometimes it is not necessary if we treat the cause. I had a patient who was a young fitness instructor, and she was doing kickboxing, and after 3 years of it, she had a lot of micro tears with calcification in both her shoulders. She couldn't move her shoulder. She was booked for surgery. And so one of her students asked her to come see me, and I loosened up her shoulders, and till today she never had the surgery, and her shoulders were working fine. And then also you see this in a lot of athletes and knee injuries and hip injuries where they don't warm up enough and they've got all these tight muscles, and the hip being a ball and socket joint, there's a lot of grinding and inflammation that happens. And same thing with chondromalacia with the knee. With athletes, you find that they have a lot of crepitus and a lot of inflammation. So when you can give acupuncture with that, it'll help. But what they do surgically at the end is shaving the undersurface of the patella or shaving the head of the femur, and you can do it only that many times. So when these people come to see me, I've given so many of them acupuncture to get the inflammation down and then loosen up the quad muscle instead of treating the knee per se. And they didn't have to have the effective surgery. But then you also have cases that do require surgery because of they do require surgery because they need to have their knees replaced, so what you can do is loosen up their muscles before they have the knee or hip replacement, and the rehab goes so much better because when the muscles are tight and then you cut them with surgery and then they have scar tissue to deal with, the rehab is very brutal. So so now the chronic pain injuries, this is continuing with the GTP, as I said, is an advanced. Why is this coming down here? Sorry. So in conclusion, I call this webinar the marriage between GTP and dry needling and acupuncture, because these two go hand in hand and you cannot do one without the other. These are two very powerful tools in the treatment of chronic myofascial pain and dysfunction, and you need to do these two to get the required results. Clinical success, again, is achieved when the body is in balance and functioning optimally. When you're restoring the physiological biochemical balance and correcting the autonomic balance and nervous system, balancing it, and also the yin and yang, and doing the energy work with acupuncture, which I call kind of fine-tuning your treatment and getting it ready when the body is in balance, everything works much better. And now this allows you to correct the muscle imbalance with the dry needling, which corrects not only the myofascial tightening, but also it corrects, it's like finessing the treatment of pain because you're getting rid of the cause of pain, and the two of them work really, really well. So the key to treatment is balance with the body functioning optimally. And the results with this then are not only dramatic and long term with positive outcomes. And I said the body has great capacity to heal given the right environment. And when also the human body is an immaculate piece of machinery, when the bones and the muscles have to work well for it to function well. And it takes over 200 bones in the body with to experience thousands of pounds of pressure per square inch to perform the simple task of walking. So no matter how well your skeleton is developed, it takes the muscles to move the body, and hence the myofascial release and treating myofascial pain is so important for more mobility and getting the patient's pain under control. Sorry, I've got a couple of my patients came 2 weeks ago, and I told them to just do a short video clip of their after the treatment. So this is the video.
Dr. Gokavi, I don't think we can hear the sound on the video.
There's no sound, you see. Oh dear.
You might not be able to share the sound.
Okay, so maybe I won't bother with this then. Can you hear this?
No.
Okay. How do I stop this? Just put me back. I have still something to say. Can I talk?
Yeah, keep going.
Put this off. In closing, I just wanted, I'm hoping after this presentation that you all will take away a few clinical pearls as to how to treat a patient that comes with chronic myofascial pain and dysfunction and get good results and long-term results. I'm sure in your practice, you all have been seeing a lot more cases of chronic pain as you're finding it is becoming a silent epidemic. So, as I said, my patients have been my best teachers, and I'm sure with your practice, with their pain, if you can use these two techniques together, you're going to get really good results. And I'm hoping that now you can approach a difficult, complicated case, however complicated it may be, that you'll be able to treat it and get these results. So I'm open now to answering any questions.
Thank you, Dr. Gokavi. That was wonderful. There's so much information and you have so many years of experience. And it's really nice to be able to see that marriage of working with those two modalities together, and to see it over time and time again, the success, and really to hear the origin story of it, and that you just tried something, went back to basics and it worked, and then you kept trying over and over. So I think that's really important for us to remember as well. So we can go to some questions if anyone has any questions. There's a couple of very flattering comments saying that you look great, Dr. Gokavi.
Well, I sure hope you got something out of this presentation, because I said, when you can make a difference in a patient with chronic pain, not only is very therapeutic and gratifying for the patient, it's also very rewarding for you as a therapist.
So somebody's asking, what frequencies do you use from the e-stim and why? Maybe you could go over that again.
I use 200 hertz for the muscle. That's the muscle frequency, and it relaxes the muscle, and 500 hertz is for the numbing effect, and it numbs the whole area. It bypasses the endorphin cycle, so you get serotonin, which is your happy neurotransmitter. So it works really well. The two together with first the acupuncture endorphins and that. So, and they don't feel much. You can give it long enough, and they really can't feel much. I was treating, when I was doing this, teaching the GTT to some of Dr. Gunn's technicians, students, the education coordinator, she hooked up the GTT circuit and numbed her whole leg. She couldn't feel the leg at all after that. It was that numb to
Wow,
do the needling. So, it really, for people who are needle phobic, that works really well.
that's great. Are there any other questions, or was everything very clear? Are you excited to go and try your own techniques? Maybe you can talk a little bit about the course. I know you touched on the GTT a little bit, kind of how it started and what you're teaching, but maybe some of the interesting points of it, like what do people need to have to attend, or what are they getting from it?
Well, I teach people who are naturopaths, who are chiropractors, doctors, physios, anyway, but the prerequisite is acupuncture. So that's why in the BC College of Physiotherapy, they consider my course an advanced dry needling course, because I insist that they have acupuncture training, because you have to do some of this when you're treating chronic pain to be able to. And then I do the GTT course itself. After COVID, I've been doing it for 5 days, and you get everything in one shot. And so in the first, the initial course, the level 1 is usually 2 days, and the advanced level is 3 days, and we go through all of the with live patient demos, and they then practice on each other. So it's a very intense hands-on course, and I keep it limited to a few students so that they supervise. And it's a lot of difficult needling, getting to areas which are very difficult to get in unless you know what you're doing.
Mm. Are there any questions from people? There's a lot of information. I'm sure you have a million of cases to choose from. And, we really appreciate you sharing and being able to find the one that kind of challenged your practice and, or inspired it. So,
Well, when you get somebody with such an overwhelming history, you wonder what the heck are we going to do? And you had said pick a challenging case. So I thought most people, when they see something like that, you don't know where to start. And yet,
yes.
because of what I did with acupuncture first and then the dry needling, I was able to get all these results, which is always so amazing to me that I can make that change, because you never know how the patient is going to do. But they've proven me wrong so many times, and I've said, okay, we'll try one, and it always seems to work. So the two together work really well, because you're getting rid of also the cause of pain with the dry needling, which by just doing acupuncture you won't, but you set the stage and the foundation to do the dry needling with acupuncture by doing all the balancing everything and giving the energy points and et cetera, et cetera.
You tend to mostly have cases that you only see people for a short period of time?
Yeah,
Because
that's true. I see my patients, my turnover rate is really fast. I see a patient a couple of times a month apart or 6 weeks. So you saw that patient such a thing, and I was seeing him spread out in 6 months. I saw him only 3 times, but usually a couple of times I'm usually done with the patient if it is straightforward myofascial pain. And I see them a month apart. Now, if they've had surgery, that's a different story. They need maintenance work, and they come to see me, and what they called is like a tune-up.
Right. And even with the tune-up, you would kind of do the same acupuncture.
Depending on what they have, and I just loosen everything up. Like at this time of the year, I do a lot of golfers. They get loosened up so that their golf game is better. So I get a lot of athletes, because then you want everything to be working well, right? And so it really makes a big difference when you loosen up everything. And people who've got chronic issues, they come as needed, because once I do it, it lasts a long time. It's unfortunate that video we couldn't play. This lady had fibromyalgia and lots of things, 20 years or more, but she does well. She comes, sees me every 6 months, and she's good to go. She's doing really well. So
That's
it all
excellent.
just depends. Yeah, so you're getting rid of the cause of pain and loosening and everything works well, but you have to do the energy work and all to be able to do the dry needling.
Well, maybe we can get those videos and be able to include them when we share the recording of this presentation so that people who have registered can kind of be able to hear what they said.
Yeah, I don't know why it didn't come through there. We'll try and figure out something.
Yeah. I think that we don't have any other questions. It seems very clear, your presentation. I hope that everyone got a little bit of something for their own interest, their own practice. If not, you know, you can always re-listen to this.
Well, I hope it was clear enough. I tend to speak a little fast, so I don't know how well how well people could hear. And I covered a lot of stuff in a short period of time, I know.
That's the great thing about technology. We'll have this able for people recorded and people can listen to it at their own pace. But we really appreciate your time and sharing that with us.
Well, it was my pleasure. Thanks for having me. That was
Thanks
great.
very much.
Okay.
Thank you, everyone, for
All right.
attending. Have a great
Okay.
night.
Okay. Bye-bye.
Bye.